Hello everyone, it's Keith Higman, Island County Public Health Director, here today to talk about COVID myths versus facts. One of the things we're hearing from the community is that the COVID vaccines were created too quickly and therefore are unsafe. I'd like to spend a few minutes talking to you about the process that was used for approving COVID vaccines for community use. The federal government was involved with FDA, lots of community partners, nonprofit organizations, pharmaceutical companies, other countries, and it was a concerted effort to invest lots of resources early on in the production of vaccines, the testing of vaccines. Almost 115,000 people across the country participated in phase 3 clinical trials. That is, they offered themselves up to get vaccinated. Their outcomes and things that happened to them and didn't happen to them were compared against a group that was unvaccinated so that the scientific community could understand what impacts might have affected individuals during those clinical trials. All of that data was provided to the FDA for consideration. There were scientific panels. The Western States Pact also had an opportunity to review the science and literature, and there was a unanimous recommendation for all 3 vaccines after going through clinical trials, after the review of the data, and comparing the benefits weighed against the potential consequences of getting vaccinated, and all 3 vaccines were determined safe for emergency use authorization. That emergency use authorization did not cut any corners, did not change the scientific rigor of the evaluation, did not change the standards that still had to be met for the distribution of vaccine to the general public. Those vaccines, through the emergency use authorizations, went through the same scientific rigor as many other vaccines that are used in the general community. If you'd like to learn more about the emergency use authorization process, go to fda.gov or cdc.gov. Thanks.